removal of an internally migrated stent in a collapsed pseudocyst cavity with a lumen-apposing metal stent. A 28-year-old gentleman with history of acute pancreatitis secondary to alcohol abuse presented with a symptomatic pseudocyst. He underwent EUS-guided cystogastrostomy with placement of 2 double pigtail plastic stents, one 10 French stent and one 7 French stent. ERCP was performed and showed pancreatic duct leak, and a 7 French plastic stent was placed in the pancreatic duct. On follow-up, there was complete resolution of the cavity on ultrasound of the abdomen. He was taken back for stent removal and to obtain a pancreatogram to assess status of the pancreatic leak. A plastic stent arising from the pancreatic duct was removed with a rat tooth forceps. On fluoroscopy, there were 2 stents. One was the externally migrated cystogastrostomy stent in the gastric lumen and internally migrated stent in the pancreatic collection. The pancreatogram was normal and no stent was placed in the pancreatic duct. The externally migrated stent in the gastric lumen was now removed with the help of rat tooth forceps. Options were discussed for removing the internally migrated stent, including surgery, but the patient requested an endoscopic approach. On EUS, the cavity appears completely collapsed with the externally migrated stent in it. A 19-gauge FNA needle was then advanced across the gastric wall and contrast was injected to confirm the needle presence in the collapsed cavity with the stent. A 0.35-inch guide wire was then coiled in the cavity, followed by advancement of a 6 French cystotome and dilation of the tract with a 6 mm biliary balloon. Following dilation, a lumen-apposing metal stent was advanced with much difficulty and placed into the collection with the plastic stent successfully. Next, a forward viewing endoscope was then advanced into the gastric lumen and across the newly placed lumen-apposing metal stent. The guide wire can be seen inside the cavity and the inward migrated 7 French plastic stent was identified. This was then grasped with a rat tooth forceps and with gentle traction pulled out of the cavity successfully. Contrast was injected and demonstrated no leak of contents. Next, the lumen-apposing metal stent was removed successfully. Patient had no post-procedure complications and was discharged the following day, and patient is doing well on telephonic follow-up 2 months later. Thank you.